The mink has a long, slender body, long, bushy tail, short legs, and sharp, powerful teeth. These characteristics allow minks to be extremely agile runners, excellent swimmers, and efficient hunters. Minks den in small family groups along streams and lakes, and their diet typically consists of small mammals, birds, eggs, frogs, fish, and crayfish. Their hunting behaviors have been described as aggressive, persistent, courageous, since they are usually solitary as well as nocturnal hunters. The mink shows an obvious sexual dwarfism, meaning that the sexes of the same species have different characteristics. For example, the male is considerably larger, weighing about 3.5 to 4 pounds and measuring about 16 inches to 17 inches, while the female weighs about a pound less and measures about 12 to 13 inches.
In humans, the directional terms ventral and dorsal are interchangeable with the terms anterior and posterior. But in four-legged animals, like the mink, ventral and dorsal are synonyms with inferior and superior. The fingers are distal to the elbow, the knee is proximal to the toes, and so on. When a human is in standard position, the ventral side is facing the view in a four-legged animal. However, the ventral side is their belly, which is parallel to the ground.
Okay, so the digastric should be right around this area. The masseter is right here, or it can be on this side. Really, it's on either side. Then over here is the sternomastoid. There's the clavotrapezius, the clavodeltoid. They're all like in this area. Then the pectoralis major and minor are over here, like where their chest area is at. The latissimus dorsi is on this side, like near the abdomen, but like on the side. Next, the temporalis is more on this side. It can be seen easier on this side. It's like around this area. You can also see the masseter from here. It's basically like kind of like near the jaw. The clavodeltoid can be seen right here. The latissimus dorsi. There's the levator scapular ventral, which is near this area. And the acro, you can see here, it's the temporalis. Then you can see the masseter here. You've already seen like the latissimus dorsi. We showed it like previously. There's also the clavotrapezius. You can see it from here. And the clavodeltoid as well. Then there's the spinotrapezius, which is like near this area. There's the levator scapular ventral, which is like near this area as well. And the acromiotrapezius, which is also like near, like these are all sort of like in this section. Yeah, the temporalis over here, masseter, and then in this section is the rest of the set. As you can see over here is the dorsipectoralis, and then also you can find here the triceps, the long head and the short head. So it's just near this area. You do have to kind of turn it on its back in order to see it, or you can see it when it's like laying down, but it's more towards this area. So that's where you can find the triceps and the dorsal as well. Okay, so I have it laying down, tummy down, and from here you can kind of see the gluteus maximus. There's the sartorius near over here. Then there's the tensor fasciata, the biceps femoris, the caudo femoralis, which is like near this area over here, as well as the semitendinous. And if you turn it this way, you can kind of see it a little bit more, like the sartorius and the gracilis. So yeah, that's all like in the bottom area, and you can see it from like right here, or you can turn it to see like the different like a different perspective of it.